are a matter of discussion. Am I audible, ma'am?
Yes, yes, doctor. Yes,
Okay.
doctor.
So yes, it's a matter of lot of education and support that's needed during the entire reproductive phase of a lady. So it's definitely important that, we have forums like this where we discuss about whatever problems we are going through and seek help and live better.
Yes, doctor. Rightly said, doctor. So, like you already mentioned, that nowadays girls attain puberty at early age, sometime at early as 10 years old, right? And they must handle more than what they can at young age. For these young girls, what is your advice, doctor? How should they be maintaining their hygiene practices?
Like I said, girls are in the childhood period. They're just still playing around. They hardly have awareness about anything other than studies and play. So these emotional changes, these hormonal changes definitely have an impact on them, because not all the girls are in the same phase. So they need extra support, and they should be reassured that it is normal phase. And so importantly, they just cannot take care of themselves, let alone even, taking bath also. Still many of them will be needing help and support from parents. So that being the case, I think it's a very important role of the parents, about the peer groups, and also the school teachers who, help the children of this age cope up better. So a lot of education is needed, and a lot of supportive educative platforms in the form of educative tools, books, videos, and motivational videos and all could be helpful, I would say. But a major part of this at this age still is a responsibility of the parents. As a child, yes, she can be motivated to learn and pick up. I would say it is difficult for a child of this age, but at least a support of about 1 year might help her cope up with things better.
Yes, yes, doctor. True. And also, doctor, research states that improper hygiene during menstrual cycle leads to reproductive tract infections. There are many self-hygiene products in market today. So, doctor, please advise on what kind of products are safe and which need to be avoided, which are harmful.
Well, yes. Again, the flip side of having the social media is, the variety of products get advertised in terms of promoting safe hygiene practices and all that. So, how much of, and some of these are also promoted as for pleasure and etc. So, one needs to be very careful while choosing what is good for them. There should be some scientific evidence proven for the use of this. So anybody buying anything, any product for their safe hygiene practices they should have a sound knowledge of what's good for them before they buy. Now, could you just repeat that question again, the first part?
Yes, doctor. Actually, there are many products, personal hygiene product like cleansers and all, right? So
Right.
some are harmful to the health. So based on marketing, people just go and buy it, and some girls don't know also whether it is good for health and is it safe or not. So I just wanted you to advise them on this aspect.
Yeah, there have been many patients who report to us, can we use this particular cleansing solution or another variety? And it's very popularized, sadly. It's so probably because of privatization sector or don't know what. So they do use a lot of solutions telling that this is going to take care of the intimate parts. So better use these cleansers. But in our opinion, which is scientifically proven, it is just minimal basic precautions that are need to be taken. It's just as simple as once or twice daily washing of the intimate parts with water and mild soap that you would generally use. Avoid using any of these, marketed products which say that they are going to be very user friendly. So now this is something very important, because the ecosystem, the vaginal area is also having is having a pH balance which is already set. So when we start using these marketed products, they tend to cause a lot of irritation and allergy, and end up flaring up more symptoms than needed. So it may cause more of vaginal dryness rather and causing the symptoms to worsen. So I would say that whatever may be the agents, if they want to use, it would be better with the advice of the doctor and then consider use. Otherwise, simple practices, just like using some breathable panties, cotton wear panties, or, using some, as I said, water with some mild soap, avoid keeping the area dry, avoid using talcum powders. And all. So these are some simple steps that are just needed. Avoiding some agents like Dettol, even, to wash some panties. They just alter the pH balance. They cause a lot of allergy to the skin. So it's better that you treat frequently instead change the innerwears. That would be better in terms of personal hygiene. When here specifically, I'm speaking about the local hygiene because general hygiene is fine, but the local hygiene, what we consider, is very important and very ignored. So, and it lands up in trouble simply. Yes.
Yeah, that's true, doctor. And also, doctor, there are many kinds of sanitary napkins, tampons, and which are available in the market for women nowadays. So, what kind of products are safe, and how often should the women be changing the napkins during menstrual cycle in order to prevent any kind of infections?
Very well thought question, actually. Drawing our attention, the era has changed. Women used to use, cloth in the past, and it is still happening. Still, children or school age children are made to use cloth for periods, which is really, really not safe. So it tends to cause the child to be more prone for infections, and it's not recommended. So, and now, due to awareness and education, yes, the use of sanitary pads and all have come into work, and that's a very great change, I would say. Again, they are not fully aware, probably due to the cost issues, or due to the busy schedule. They just forget that it's important to even change the pads during the day. So it's at least the requirement of pad will be definitely to to absorb the soakage, but it should be at least changed once in 3-4 hours, because the moment there is a pad with soaked blood, it becomes also a media for the bacteria to grow, and that causes more of odor infection to follow. And this is not a one day event, it's a period which happens for 3 to 4 days. So it's recommended that at least the pad gets changed every time it's fully soaked, or 3 to 4 times a day minimum. Now, with the use of tampons, yes, the sanitary tampons are available, which can be safely used. And off late, what we have is the menstrual cups, which are, which are increasingly getting popular. And I think we'll be discussing about it shortly. So,
Yes.
yeah.
Yes, doctor. That was my next question, actually. Many women are switching to menstrual cups from sanitary pads. So is it really safe and hygienic, doctor, to use menstrual cups? And please let the audience know what are the pros and cons of these menstrual cups, and what are the alternative feminine hygiene products which are presently available.
Well, regarding the menstrual cups, I think it's a boon for usage if correctly used. So now this is a foreign body that we should always remember. It's a cup which has to be introduced. When introduced, you should also remember to remove it. That's the main thing that is involved here, and also the correct usage. So the menstrual cups are going to be a very good alternative to napkins. First thing, you avoid using some napkin which needs to be discarded, disposed. It's a biodegradable product, yes. Sometimes it's not fully biodegraded. So it is also an environmental hazard. So if you have something like a menstrual cup, which could just, you just need to insert it in the vagina, it tends to collect the blood, and you just need to discard it, wash it and clean it, get it sterilized in hot water as with recommendations, and it's fit for use for the next day and the next period and the next period. So you can comfortably use it for 10 years at least, they say, if properly used. And it's very, very economic as well. So it's just 1 or 2 times you just need to buy and keep and change it if you're really fed up. So it's a very good thing happening. Just that the person needs to be taught here as to how to actually use it. And it takes 1 or 2 or maybe 3-4 uses to get used to it. So have that much perseverance to try using this menstrual cup. and so that it should properly sit, and so that in the vagina, so that the blood collects into the cup and it can be discarded. So here the pros are much more, because you tend to avoid using pads. You don't have to carry pad. It's small, and conveniently you can carry it, and it avoids odor, infection, and all. So you don't have to wear a sanitary pad. So this becomes a very comfortable day for you, just like any other day. So the menstrual cup is definitely something recommended, I would say. Yeah, the only thing is, if you put it in, you have to remember to remove it and wash it and correctly sterilize it. So there are proper equipments where you just need to keep it in the water solution, boiling water for 15 minutes, and it is good to use for the next time. So definitely, I would say recommend the menstrual cup for the girls coming up. Yes.
Okay. Okay. Thank you, doctor. And during menopause, women a lot of changes in menstrual cycle. They usually experience heavy and frequent bleeding because menstruation is about to stop, and this is experienced by most of the elderly women. So, what is your advice for women at their menopause stage, doctor?
So this transition of a woman from a reproductive phase to the menopause is definitely distressing to at least 30 to 40% of the women. So if you have a population where 30 to 40 in 100 women are going to go through symptoms, it's definitely worrisome. So yes, the transition is sometimes difficult for a lady, because it's not like, some very few women are lucky where, periods are happening regularly and it just stops for the good. So it's not that way. So the obvious reason for this transition is that there is going to be fall in the egg stock as we age. So because of this, the hormone production also is going to fall. And that's the reason, there's an important hormone called as estrogen, which is responsible for the normal well-being and the menstruation also. So when this hormone starts to fall, the symptoms of menopause also increase. So it's not just that the menstrual disturbance is there, but they experience a lot of symptoms in terms of mental agony and disturbances. There's a lot of hot, they say something called as intense heat and sweating happening. That's called as hot flushes, bone weakness, cardiovascular health problems. There are many things that could happen to the lady as she reaches menopause. Specifically, when you talk about the menstrual disorder, menstrual pattern, it could be very erratic. It could be that she bleeds continuously, and that leads to a fall in her hemoglobin, causing her to have a lot of weakness, and that may definitely automatically she'll seek for help. The other one being that they just bleed for a long time, or they could bleed frequently. So again, it is embarrassing sometimes. And, so the pattern of bleeding, it may be good for them that it may stop after some time. They may be lucky. But sometimes this is also the age where they also develop other diseases. It could be something like fibroid, benign tumors, or sometimes cancers, or it could be a cancer of the cervix. So for these reasons, it's very important that the lady follows certain simple things. The first important thing she needs to do is to maintain her menstrual calendar. So this would apply to any age actually, where she records when her menstrual cycle happens every month. What is the duration she has, whether it was heavy. So just a small minor note would help her assess the bleeding over a period of time. And if she feels that it has increased or it has not resolved, she can obviously seek for a medical help. So that's very important. And it's always good to visit a doctor and we get it reassured. So all she needs to do is, suppose she has a family history of malignancy, cancer in the family, that should again raise an alarm that she makes a visit to the doctor, rule out other possibilities. That one simple step can even pick up something as bad as a cancer, and we can handle it better. So a lady nearing menopause is not only like physiological, it could be even something which is very dreaded. So it's very important that she seeks medical help, not to panic at the same time. Yes.
Yes, yes, doctor. And also, many women go for hormonal treatment, hormonal therapies during their menopause stage. So, is it all recommended, and is it really safe, or how do you suggest, doctor? Should they undergo this process like a natural process, which happens in every woman, and menopause is very common?
Menopause is inevitable for any lady if she survives beyond 50, isn't it? So
Yeah.
definitely, as I mentioned, 30 or 40 out of 100 women go through this phenomenon. So it's like a very huge number. It's almost like 50%. 1 in 2 women will be having this problem. We can definitely not ignore it. Nor can I have some suggestion like over-the-counter drugs. I can't say go to a pharmacy and pick one drug and just enjoy it or try to manage. Nor can we leave her. It's very important to tailor the treatment for every lady who is going through this phase. So definitely the symptoms also will be different. For some women, it will be bone issues, some it will be a heart, cardiovascular issue, it could be something with cholesterol issues, it could be just hot flushes, as I just mentioned, urological symptoms, it could be vaginitis, it could be something to menstrual symptoms. So definitely, depending on the symptoms, they need treatment. So there is no universal treatment here. And there is hormonal treatment which is recommended, which was very popularly given and over a large scale. And then they saw some dreaded side effects like cancer, and they got worried if they are connected. So the popularity of the usage of this hormone therapy came down. So then finally they ruled out that this is not directly linked to cancer, but we cannot just blindly give this. So every lady has to be examined. Her blood pressures will be checked, weight, her risk factors, and then they may be subjected to hormonal or non-hormonal treatments here. And importantly, what we understand is that it's not like you take treatment, you're going to get cured. It will help you cope up until that time. It's not a all-time treatment. So
Yes.
therefore, so therefore one should meet the doctor and see what's best for her. It could be as simple things as lifestyle modification also. So yeah.
Yes, true, doctor. And one more very important topic, doctor, which many women hesitate to discuss openly. It is about sexual hygiene. So everybody knows that sexual hygiene is very important, and every woman need to know that intimate hygiene will reduce the chances of getting infections. And this also diminishes the possibility of contracting all sorts of sexually transmitted diseases. So, doctor, kindly elaborate on sexually transmitted diseases and their effects on women health if the sexual hygiene is not being practiced.
Yeah. As you said, this is a very, very untouched topic for most women. They want to discuss about it, but they just wouldn't open their mouth about to discuss, because it's a
Yes.
taboo to discuss about it. So every lady will be having some amount of vaginal discharge in her lifetime. So sometimes she gets concerned, that this discharge is not normal, and she starts worrying if this is something related to sexual practices, whether is she under some infection, so that really worries, and they just approach us at that time, when they're totally distressed. You could just avoid it by even approaching a bit earlier. Now, what one needs to understand is it's definitely these infections are due to are sexually transmitted. Now, what are these kind of infections? It's not just this HIV or hepatitis B, which we talk about. It's as simple as some infections which are locally there in the vagina. So they are sexually transmitted. And they also present with vaginal discharge. Additionally, they could also have some other symptoms. So what's important is you try to recognize what kind of symptoms you're exactly having. Now, to understand this, you should know what is normal vaginal discharge. So normal vaginal discharge for any lady would be, after her periods, for the first 15 days would be a watery discharge. And then after that, for the next 14 or 15 days before her period begins again, it will be a thick white discharge. So anytime a lady sees the discharge is more in amount, it's foul smelling, or it is itching, or it is associated with other symptoms like, pain, fever, or some blisters are there, so that's when she should, think that she needs help, and she approaches the doctor. So now the reasons for sexually transmitted diseases, it could be many. It could be having multiple sexual partners. That also we should remember. So it's always very important that one uses barrier contraception. I think we all are aware about condoms, male condom, the female condom. That's the only way by which you can protect against sexually transmitted diseases. So even then, when you develop symptoms of, some discharge which is itchy in nature, which is having a fishy smell, it could indicate something as serious as a bacterial vaginosis. Sometimes women may notice some yellowish frothy discharge. That is a parasitic infection that is also sexually transmitted. It is called as trichomoniasis. And there is sometimes an infection called as gonorrhea. So there also the lady presents with white discharge, which is foul smelling, which is itchy. So it's all the same symptoms with little pain. Sometimes it could be blisters. So that's when they need to approach the doctor. What's the good thing about it? There is treatment for it. So you just need to take some pills as prescribed by doctor and also get the partner treated. And hence, after that, at least try to use condoms as a measure to protect further attacks.
Yeah. And also, doctor, some of the research studies state that sexual unhygienic condition is an important factor for infertility in women. And many women doubt whether this is a myth or a fact. Doctor, please let us know, how is sexual hygiene related to infertility?
There are various reasons for infertility. So just because a person is infertile, they shouldn't think that they're having some STD related cause. So, but definitely, as you said, STD could, the sexually transmitted disease could be a reason or some for the infertility. Now, when we speak about sexual unhygienic practices, we are basically again coming back to sexually transmitted diseases. So some infections that I just mentioned, like the gonorrheal infection, chlamydial infection. So they are all bacterial infections which can cause damage to the reproductive system. So we all know that fertilization, the baby is formed in the fallopian tube. So these organisms just go into the reproductive tract and they damage the structure. So that is how that could lead to an infertility. So, or frequent infection in the fallopian tube or the reproductive organ that causes a condition called as pelvic inflammatory disease. So causing a lot of symptoms, pain, blockage of the tubes, and that may contribute to the infertility. So yes, partly I would agree that improper sexual hygiene practices can lead to infections such as gonorrhea, chlamydia, that could cause a damage to the reproductive organ and contribute to infertility.
Okay, doctor. Thank you. And coming to pregnancy care, doctor, I have a very important question. So it is noted that 1 in 5 pregnant women develop vaginal infections. And these pregnant women, though they take a lot of precautions, they always worry, like, how come they got these infections? So what do you suggest to these pregnant women, doctor, like how they should be taking care of their personal hygiene during their pregnancy period?
Okay. So now, as you said, pregnancy is a very delicate, phase of a lady's life. One should understand that her immunity is also on the lower side. So she is more prone for any kind of infection during this time. Also, pregnancy is also a shift in the hormone. There's a big shift in the hormonal pattern. So that hormone pattern also has an effect on the ecosystem, that is the environment in the vagina. So normally the vagina and the cervix, they tend to produce some fluid. So under the influence of this hormone, so this gets a little bit altered in pregnancy and the fluid secretion changes. That causes the pH of that local vagina also to change. So it becomes more acidic and that favors certain fungus to grow over that place. So that is why they will have this candidiasis very commonly in pregnancy. That's the most common infection. They come with complaining of white discharge, which is curdy white in color, sometimes itchy, and they get really worried because they are worried it may cause some harm to the baby or to her pregnancy. So that's why they would really come. Here, what we need to do is mainly reassure it's a local infection, which is very much treatable. So your doctor will be giving some pessaries to, treat that infection. And otherwise, it will not really cause some infection in the vagina at least. Otherwise, they are prone to any other infection because of lower immunity here.
Okay. So,
Does
doctor,
that answer your question?
yeah. And also many women, when they are pregnant, they feel that if these kind of infections happen, either it is vaginal infection or urinary tract infection, like it might lead to abortion. They are very worried. How much chances are they, doctor, like if these infections happen, that abortions do also happen?
Now, when we're speaking about infection, we should understand what infection are we speaking. Now, you mentioned importantly about urinary infection. That is also very common in pregnancy. The reason being because of this hormonal shift is, again, the lining of the urinary bladder, they also change. They become more, tender and sensitive. They're more prone for breakage and infection. So that could be one of the reasons. Now, urinary infection is, if not treated, it could be causing something harmful. Now, the urine which is in the bladder, it can go up the pipe that's called ureter and go into the kidneys. That infected urine or infection can flare up and it may cause infection around the kidney. That is one thing what can happen. Otherwise, yes, it is possible that they can trigger labor process also. So any lady who is having symptoms of frequent visits to the loo, having a burning sensation while passing urine, having fever, having loin pain, or having a little turbid yellowish urine, she has to get tested for urinary infection. And every pregnant woman is routinely screened for infection also, keeping this in mind. So it's very important that you go for the lady goes for her checkup and also gets her urine tested if she develops these symptoms also. So if there is any infection, it is treatable. Treatment has to be taken. So if not, it can cause a recurrent urinary infection and could contribute to trigger the labor process a bit earlier. Otherwise, infections like candidiasis, as I said, it's not going to trigger labor process as such. Now, certain other infections could have been acquired. There are also, some infections like rubella, toxoplasmosis. That is, I think, beyond the scope of our discussion. They can cause something as bad as an abortion or a, labor to get triggered off.
Okay. Okay. And also, doctor, not just during pregnancy, after delivery, that is, once the pregnant woman has given birth to a child, there are also more chances of infection. So, please elaborate on what kind of infections happen post pregnancy and what are the precautionary measures that these women should take after delivery.
That's a very nice question. Now, there are two important things that we need to look into here. A lady who has just delivered, she's tired. Whether it is a normal process or it's a cesarean process, and they are usually bombarded with relatives to come and see the mother and the baby, more importantly. So the lady never gets a space to be with herself or with the baby. So that itself is an important trigger where she starts feeling uneasy, even to visit the loo whenever she wants to. So, therefore, that's the area which is most, vulnerable for infection now because it's quite blood filled right now. There'll be a lot of blood discharge going on. She would have been using pads during that time. So if she doesn't get an opportunity to go and visit the restroom to, frequently change the pad, wash her local parts, it's very probable that infection could set in. Another important reason, even if she's delivered normally if it's usually the first delivery, they get a cut on the local vagina, so that to enable the baby to come. So again, because of that cut, there is an infection that's probably going into the system, in the body, into her body, very likely. If she doesn't keep that local area clean, she is bound to have infection. Here again, simple practice would be every time she visits a restroom, she has to just clean her local parts. And after her ablution, she just comes back and she frequently changes her pad. Takes a lot of fluids, and so that any bacteria or anything can get flushed out of the system by urine, right? And importantly, she would be given medicines in the form of antibiotics to take that appropriately. Now, the other factor being in pregnancy, there could be more causes, other causes contributing like anemia, or if your weight is on the higher side, obesity. or diabetes complicating pregnancy. So they are again some trigger or precipitating factors to invite infection. So these women also should be taking extra care. Maybe it's their blood sugar, or they have to make sure they are keeping their local areas clean. Yeah. So I think that's why they are more prone for infection when they don't take care of these small little things.
Yes,
And
true,
they'll
doctor.
not go and have bath.
Yeah. Hygiene, personal hygiene, even during pregnancy and post-pregnancy are very important, doctor rightly said. So now I would request Dr. Isha to take over the Q&A session from the audience.
Thanks, Dr. Jamuna. And Dr. Sabitha, I would say it is a really engaging session that we are today, having, and all the questions. And I think a lot of taboo, is around female hygiene, and we are trying to, reduce that and by talking about it. So I would like the viewers to let us know if they have any question. They can raise their hands. Meanwhile, I will start taking up the questions that we had collected while we were talking about the webinar. So, Dr. Sabitha, we had one question like there are skin outbreaks, acne and pigmentation. So normally they are related to, hormonal imbalances. Is there personal hygiene plays a part in it? Is there a role because of which they may develop such issues?
Okay. Yeah, this is one of the common issues during the pubertal age also, isn't it? So many girls, they come with complaints of acne. Now, this could be related to a hormonal issue. One of the common conditions we speak of is PCOS, and people just panic about that condition. So there actually, because of the hormonal imbalances, it so happens that, there are glands in the skin. They're called sebaceous glands, and they secrete oil. So, oily secretions, and that get blocked, whenever you don't wash your face regularly and all, these pores get blocked. So this becomes an environment or a nidus for infection to happen. And that's why the acne flares up. So children of today, or the youth of today, they're already, overwhelmed by their stress for their career and studies. So they just don't pay attention for all on these small little things. The stress is so much that they get consumed by it. They don't even take care of one simple thing like washing face at least 2 times a day. So what I would recommend here is at least, just at least 3 times a day, morning, afternoon, and evening, to regularly wash face and use a moisturizer and a sunscreen. That would be a very good way to take care of our skin hygiene. That not only flushes out the pores, it keeps it moist so that, there is no infection that can, set in as such. So personal hygiene as children of today, that's one thing they need to take care of.
Yes, I agree. So, doctor, in the answer you just mentioned, the stress can be, a major factor that can lead to, people forgetting about understanding their female hygiene or personal hygiene. So what do you think, is mental stress actually related? Or, and what are the, tips that you can share so as they can make sure that, they do practice such things so as their personal hygiene is maintained?
Yeah, as we know, this is a fast moving world, everybody wants to run in this rat race and they want to win. So all are definitely stressed. Why only children or youth? Even you, me, all of us are stressed. And nobody really needs an explanation that when we are stressed, we are just focused on the stress. And, we are just lost there that we forget doing anything that is, usual or essential for our life. So that's as simple as a personal hygiene. So we just don't bother about anything. We just want one goal, focus on what we really want, what stresses us. So what I think here we should do is, break that myth. I mean, you have to bust that vicious cycle, recognize that, oh, I'm in a trap of this stress, and then, dissociate from it and take a break. It's fine. It's nothing that the world is going to end in the next minute. No, just find some mechanisms by which you can de-stress. That would be individualistic. For some people, it could be a simple meditation. It could be just a casual walk outside, just chatting with friends. So I think it is subjective. Each person could devise their own way. Some important things that could contribute to, de-stressing to contribute would be to, hydrate yourself well, drink a lot of water and have some food which is nutritious and healthy. So that will keep you calm and composed also. So yoga, walking, it could be any kind of physical activity that could help.
So we got one more question, doctor, from the audience. Gynecological visits or visiting a gynac doctor is something, that we female relate to, like, it may bring shame, or, they don't feel it will be an unbiased visit there. So what do you recommend, age specific to go for a regular gynac checkup? If I say 20s and 30s and 40s and 50s, is there, a schedule that they should follow for such visits?
Okay, that's a very nice question, actually. Well thought of. Now, during the journey for a girl, right from the time of puberty, there is some, as every lady is at risk of having some cancers, like be it breast cancer. I think in once in 4 minutes, there's one patient who's diagnosed with breast cancer. And every year, are close to 70,000 to 80,000 are detected with cervical cancer. So the journey of, preventing these diseases, which is very much possible, can start off just at the age of puberty. I think every girl should have a sex education that happens there, and also given an option of even immunizing. When we immunize against so many other diseases, it's also important to vaccinate the girl child to protect against the cancer cervix. So one of the important reasons for cancer cervix is, HPV infection, we call. So there are vaccines that are available in the local, government hospitals or hospitals, the clinics, where you get the child vaccinated. It can protect her from so many cancers that are of from the genital tract. And not only the girls, even the boys have to be vaccinated. So here, okay, we're talking about girls, so I'll confine my talk to that. So yes, so you should take your child to the gynecologist once she attains her puberty. Any time between 9 and 25 years is a very good time before the sexual activity starts off. Vaccinate the child with vaccines for HPV. And if there are any menstrual disturbances or something which is, which the child raises a concern, not to, put her down or make fun of her, but it is important to address her at that point, because that also contributes to her well-being. And if you don't know, please approach the doctor. So they're very friendly. I'm sure they would be helpful in guiding. So many people are, so whenever there's a menstrual disturbance, visit a doctor. There's no harm. Sometimes sometimes something gets picked up, like as simple as, as severe as some tumor. Just during the routine evaluation gets picked up. So never hesitate to take your child to the doctor and seek support. Now, during the reproductive age also, yes, a lady can visit the gynecologist when she has any symptoms, or if she wants any kind of advice. It could be before even entering into sexual life. So before that also. And there are certain things which a lady once the sexual activity starts, they have to go through this pap smear testing or the screening for cervical cancer. So that's something which they can do from the age of 21, or where they get screened every 3 years once. So that's a very good practice to detect cancer at a very early age. So they can seek doctor for contraceptive advices, right? So even to protect against sexually transmitted diseases, it could be any concern, whatever be the concern, just approach the doctor. Naturally, they will consult when it comes to pregnancy. And as we age and reach menopause, there may not be very severe symptoms, but that distress of menopause itself can, uh, be very challenging. So a lady can even come and approach. She may be just anxious. Just come and ask what are the changes she can anticipate, and then what should she be expecting next. So that is something which, and they will be taught about breast examination, how to detect breast cancer, and then they could get the screening for cancer cervix done. So that's something which they can do in their early 40s also. And once the menopause happens, come and take treatment. Just at least some consultation for their well-being thereon, for um, to embrace the elderly period. So I think anytime the lady, she is free to consult the doctor, even if no symptoms.
So thanks, doctor. I think so. It was very insightful to understand, all these phases. And I do agree that we should not hesitate visiting a gynecologist, and all that biasness that we have is in our mind, and that hesitation is in our mind. And talking and visiting will help us to understand and to even catch diseases in time, so as they don't transform into something more complicated. I think so. I don't have more questions, and from our audience, I think so. I have picked all the questions till now. We can wait for 30 seconds, and if there is no activity, I think so, then Dr. Jamuna can take over.
So, Dr. Isha, there were some patients who wanted to ask direct questions.
Okay. So I will just take them one by one. I'll just ask them with their names.
Yeah. Yes, please.
Sure. It is Shruti Prakash, the first patient. So is she there? She's not there. I have asked them to write down the questions. I think so. They have written, few of them have written those questions on Facebook that I asked. And one we have already covered. Miss Supriya, do you have any question? I have unmuted you, Supriya ji, if you have any question.
Supriya is still on mute, I think.
Now she can unmute and ask. I have asked. Yeah. Supriya ji, you can ask a question.
No, I don't have any questions. So.
Okay, that's great. So I think so it's a wrap. Dr. Jamuna, please, over to you now.
Yeah. So thank you very much, Dr. Isha. And mainly, I would like to thank our today's speaker, Dr. Sabitha. Thank you very much, doctor, for providing your valuable advice to our viewers. So
I would like to thank you and the CurePro health team to allow me an opportunity to be a part of this evening and have this lively talk. Thank you.
It's our pleasure, doctor. And this session has really helped everyone in understanding the significance of personal hygiene for women's health. And I would also request to all the viewers to avail the benefits of our care plans and diet plans, along with the care coordination services. Please download our Cure Book app from Play Store. You just have to type QURBOOK in Play Store. It is for free. Anybody can download and install. We will be very happy to serve you and your healthcare needs. And always remember, personal hygiene is very important for good health. Practice it and stay healthy always. Thank you all for joining today's session. Take care. Bye-bye.
Thank you.